If it becomes necessary for the legislature to make budget cuts, what areas would you prefer to focus cuts? And which areas would you consider off limits?
It's a great question because that has been something the legislature's been involved in over the past several years. So I think my approach to this question may be a little different since I can't phone a friend. I think I would go back to what some of the issues are that are causing our revenue problems, and that is our unbalanced tax policy. So as you're looking at making decisions, and sometimes you have to make the best bad decision that you possibly can when you're looking at reductions in any kind of a budgeting situation. I've had to do that for many, many years. What I would do is look at priorities. What are and I would talk to my constituents. What are the things that you value the most? What is most important to you? And those are the things that we need to consider to be off limits. We're representing our communities, we're representing people. And as I'm knocking on doors and listening to people about what their concerns are about our state, it almost always comes down to budget, because budget and revenue is what funds programs, and programs are what we eliminate when we have to make budget cuts. We take money from KDOT, as we've just heard earlier tonight, and you all are very aware of. We reduce our funding in education. We take programs and services away from our elderly, our veterans, our disabled, our most fragile Kansans. So I want to talk to the constituents, find out what is most important to them. That is what would be off limits to me. And I would be their voice in the legislature to make sure that we are honoring their thoughts, their decisions, their priorities.
Thank you. This question is for Representative Hensley. Sir, there appears to be little chance of repealing the Affordable Care Act at the federal level, especially if Hillary Clinton is elected president. If that's the case, should Kansas continue to decline to expand Medicaid?
That was a good question. I'm glad you asked. There's a lot of moving parts with Medicaid. The first part, and the part that I think we have to get a handle on, is what's called the Emergency Medical Treatment and Active Labor Act. It's called EMTALA. Right now, when you walk into a hospital anywhere, the hospital cannot refuse you for service for inability to pay or lack of insurance. We have individuals who are going to the hospital in the emergency room and racking up inordinate amounts of charges for things that they could handle on a physician type level or an emergent care center and the like. I'd like to see a situation where we create a Kansas project, right? Where we get physicians to engage at the emergency rooms. We get dentists to engage in emergency rooms so they act as those kind of fail-safes. When somebody goes into the emergency room and they need that emergent care, they can be farmed out to clinics that are part and parcel of the particular hospital. I think we've made a long progress. We passed telemedicine for Kansas physicians. We also have dentists and physicians this past year, both of which I voted in the affirmative, to ensure that they would treat people with charity care for purposes of obtaining continuing education credits. Another development recently over the last few weeks is what we call the 1557 Obamacare rule. It's an additional set of regulations that have been mandated from the federal government. This 1557 is a bit of a challenge for some of the dentists and physicians, particularly the dentists, who are struggling to get through some of the red tape to provide that care that they're not covered. So to the extent, and back to the base root question, I do think we need to create a Kansas solution to handle EMTALA, to handle those people who cannot get restorative care because if your teeth are messed up, you can't get a job. So I do think there is room for that continued negotiation, and if you elect me, I'll be that person that can negotiate, because I've been in healthcare law for over 12 years. If anybody knows it, it's me.
Representative Hensley. Now this question is for you. Another lengthy one here. Thankfully your time starts when I stop talking, which is good, right? The Kansas Supreme Court is expected to determine this fall whether funding for schools is adequate. If the court finds funding is not adequate, the legislature may have to boost school funding by $500 million or more. How should we pay? Excuse me, how should the state pay for that?
That is a question that I believe will probably be answered, that we probably do owe that much more money to education in Kansas. I think we will find a way of funding it, and it will probably have to come back to closing some of the tax loopholes. The biggest one right now is 330,000 people that are not paying any income tax. So my first place would look there. The second place I'd look very quickly, I would return the top bracket to the income tax. That's only 1% of our population, and I think those two brothers probably can afford to pay it.
All right, ladies and gentlemen, we're back to the one-word hyphenated two-word questions. We're going to start with Dr. Diedrich. We're going to go down the line again, and then the floor will be theirs for the 2-minute, concluding with our incumbent candidate, Representative Hensley. Now, I've deviated. We've got, well, no. We have two questions. Two words. Health care. 30 seconds.
Thank you so much for that question. When I think of healthcare in Kansas, I'm thinking a little bit about what we've been talking about earlier tonight, which is Medicaid expansion. And part of the issue that I'm concerned is that we've never been able to have a hearing at the legislative level to be able to vet the opportunity to increase Medicaid and Medicare in our state. So for me, I think it would be very, very important to be able to at least have a hearing so that we can look at the consequences and the unintended consequences, if there are any, of expanding our healthcare opportunities for our most fragile citizens.
Thank you. Okay, Representative, here's your question. Another two-worder. Here we go again. Mental health. Mental health.
Mental health. We need additional care there. We passed juvenile justice reform this past year to help young kids who are having some of those healthcare challenges. Mental health is a serious issue. I have K&I in the area who have physical debilitations. I think we need to treat mental debilitations the same way we give the attention to people who have physical incapacities. They deserve the right to be heard and to be seen as an individual and not just a number on a spreadsheet.
Editing this in my mind, I think it should have been behavioral health, right? Okay, I apologize. When we make a mistake, we make it 30,000 times when we print the newspapers. Okay. This will just be between us, right? All right, sir. Two words again. I just can't say it in one word. Early childhood. Early childhood.
Early childhood education. It's one of the more important things that we can do when we can cure a lot of problems early in life. We should do it. We have had the tobacco money that has helped us do that. We have a governor that would like to cash that out so he can fund his, I call it, failed experiment in taxes. So I will stop that.
Thank you, sir. Floor is yours for 2 minutes, Dr. Diedrich.
All righty, thank you so much. This has been a very delightful evening, although a little bit nerve-wracking, but thank you so much for allowing us to come tonight and visit with some of you about who we are and what our positions are. One of the things I'd like to say is that when I'm knocking on doors, and I have probably knocked on well over 500 doors during these June and July months, I've asked often, what kind of a Republican are you? And here's what I answer. I answer with, I'm a reasonable, rational, responsible, and respectful Republican. And I think those are some of the things. I think you need to be responsive to your constituents. You need to be able to make rational decisions. You need to be able to have the courage to face some of the issues that are confronting our legislators when they go back in January. There are some serious, serious issues that you cannot just brush off. And I also am worried that too many of our legislators, and I'm not talking about you necessarily, but many of the folks I feel are being much too concerned, and I hate to use the word owned, but by special interest groups, and they're not really listening to the hard-working, ordinary Kansans that you and I are, that our neighbors are, that the people we go to church are. And so when I'm knocking on doors, what I'm hearing are people telling me, nobody is my voice, nobody's listening to me. And I'm specifically going to tell you about a young man, actually not a young man, unless you're 82, an older man who said how upset he was with our state budget because he lost his medical exemption on his Kansas taxes, and he wasn't aware of that. He lost half of his mortgage interest, and they still own their own home. The income tax reduction did not help him. So he's feeling like he's getting less benefit now than he was before. He's paying more in sales tax. You know, these are people that look to government to aid them, to benefit them, not to be punitive toward them. And that's why I'm running. I want to be the voice for those people. Thank you.
Mr. Gile, you have 2 minutes, sir.
I think I've told you why I was running. The one thing that I would pledge to the people in my district is that I will listen, I will consider the issues, and I will make the very best decisions I can. When I decided to run, it was at the very last moment. I felt that I could serve and do a good job in this position. And my wife and I talked about funding. And I decided we could afford, at least in this first round, to self-fund. And I have self-funded my campaign, except for $175 that came from friends and neighbors. And I didn't ask for donations, but they brought them, and I felt it was, I thanked them for it. And what I'm saying is, I'm not going to be owned by any special interest groups at this point, and I will represent the people of this district.
Representative?
Thank you again for this night, and thank you, Larry, for joining me tonight. I've certainly enjoyed serving the last 2 years, and can tell you that if given the opportunity, I'll continue to enjoy serving you. This state has given me more than my fair share. I came here and didn't know anybody other than my wife. We came here and carved our way. And in a weird sort of way, we kind of felt like our own set of pioneers, as it were. We didn't know anybody, and got to know a few folks along the way and found our way. And 12 years later, I'm looking up at the ceiling getting sworn into the Kansas State House. Just a pretty spectacular story, primarily because Washburn Law gave a pretty ordinary guy like me a pretty extraordinary opportunity. And I can't thank Washburn Law enough. Now, with respect to everything else that I'd love to continue to do, as I mentioned, I'd love to continue to serve you, and here's why. Because we've stabilized capers, we've secured our highways, we've adjusted things for state employees to ensure that they have the capability to get additional funding for corrections officers and for highway patrol. There's more work to be done, and I'd love to be a part of that work. You know, when I got a call last year on the House floor, my phone rang. And I thought about my kids because I picked up the phone, and I don't know if I've told this story, and I know I'm running out of time. Picked up the phone and said, hey, this is Representative Lane Hemsley. Said, Lane, this is Governor Brownback. I need you to change your vote from red to green on the block grant bill because I need you to push this over the line. I said, Governor, I appreciate the call, but my vote's red and I'm staying red. He said, hey, it can't be that bad. I said, no, you lost my district by 25 points. Finding a yard sign was impossible. I'll stand up to the governor. I'll make my own vote. I do my own thing because my children go to those public schools too. I'm a father. I'm an attorney by trade. I'm a father by practice, and I'm a husband by correction. I hope you entertain me the right of your vote and certainly appreciate the opportunity. Thank you.